Welcome to the 2020 open enrollment season. You're watching this video because you have to sign up for health insurance soon, and the plan options you're used to having are changing. To help you understand your new options so you can be confident with the benefits you decide to choose, we'll walk you through your choices and talk about the resources that can help you get the most from your benefits. The first thing you need to know is for the 2020 benefits year, the standard PPO plan will not be available. You can still choose the basic PPO plan and the high deductible plan with HSA. You also have two brand new options to choose from. The first new option is the enhanced PPO plan with health reimbursement account, or HRA. We'll explain the HRA more later. And the other new option is the Value Care PPO plan. If you're currently enrolled in the basic PPO plan or the high deductible plan with HSA and you're happy with your coverage, you can choose to re-enroll in your plan and keep things exactly as they were before. But you will still have to actively enroll during the open enrollment period. In fact, all Inframark employees will have to actively enroll in benefits this year, even if you want to keep what you have now. Now, if you're open to considering a different medical plan, or if you're currently in the standard PPO plan and have to pick something new, we'll take a moment to walk you through each of your options. First up is the Enhanced PPO Plan with Health Reimbursement Account, or HRA. This is a new plan, and you should know that it is not a direct replacement plan for the old standard PPO plan option. This plan provides much richer coverage than what the standard plan had offered, and as a result, you'll pay more out of your paycheck to be in this plan than any of the other plan options. But being in this plan also gets you the highest possible level of coverage, which means predictable co-payments for office visits, urgent care facilities, emergency room care, and prescription medication. It also has the lowest annual deductible of all the plan options. If you choose this plan, Inframark will give you up to $1,000 per year to use on qualified medical or prescription expenses. This money is called a Health Reimbursement Account, or HRA. The funds are available to you tax-free, and you can access them with a special debit card for ease of use. However, if the funds are not used up within the year, they will not roll over. The next plan option is the basic PPO plan. This plan is closest in structure and value to what the standard PPO plan had been. And it's a great choice if that is a type of plan that you are most comfortable with. The basic PPO plan also features copays for office visits, urgent care facilities, emergency room care, and prescription medication. It has a higher annual deductible than the enhanced PPO plan, but its premiums are not as high, so you will not contribute as much out of your paycheck if you choose this plan. Your third plan option is the Value Care PPO plan. This plan gives you access to the affordable first-line, routine, and primary care services that are designed to keep you healthy all year long. Co-payments for primary care office visits, urgent care facilities, and generic drugs are the lowest of all the plan options. There's also a $0 copay for the CVS Minute Clinics and a $40 copay for lab work and low-tech imaging like basic x-rays. If you need to see a specialist, or if you require emergency care, you will have to pay the full cost for those services, subject to deductible and coinsurance. That means you'll have to pay more out of your own pocket. The Value Care PPO plan features very low premiums and the highest deductible of all four plan options. The final plan option is the High Deductible Health Plan with Health Savings Account, or HDHP with HSA. This plan has a low premium, it's the lowest out of all four options, and a high annual deductible. Unlike the other plan options, employees in the HDHP do not have co-payments for office visits, urgent care facilities, emergency care, or for prescription medications. That means you will have to pay the full cost of the health services and medications you use, and you will have to meet your annual deductible before insurance kicks in. However, this plan does have the lowest out-of-pocket maximum of all four plans. Also, The Health Savings Account, or HSA, in the plan provides you with a special tax-advantaged account to pay for qualified medical expenses. If you choose this plan, Inframark will contribute up to $1,000 into your HSA account. You're also able to contribute your own tax-free money to help grow your long-term healthcare savings towards retirement or other future healthcare expenses. Unlike the HRA or flexible spending accounts, FSAs, we'll talk about those later, your HSA does not require you to use or lose your funds before the end of a given year. Any money you put into your HSA is yours to keep forever, even if you leave Inframark someday. So which medical plan should you choose? Well, that's going to depend on your healthcare needs, your budgeting preferences, your savvy with using healthcare funding accounts, and your tolerance for risk. If your household requires lots of care, choosing one of the higher premium plans like the Enhanced PPO plan or the Basic PPO plan might be a good idea. You'll get the everyday coverage you need along with predictable prices and copays that can keep your out-of-pocket costs on the lower end of the spectrum. On the other hand, if you're generally pretty healthy and usually don't need to see the doctor very often, one of the lower premium plans, like the Value Care PPO or the HDHP with HSA, might be a better fit for you. You'll pay more out of your pocket when you need services and medication, but since you don't need to see the doctor as much, your overall costs could be much lower at the end of the year. If you do experience an unexpected injury or illness, though, or if you need to see the doctor or use more medication than you planned for, then you need to be prepared to potentially pay a lot more out of your own pocket. When you are considering which plan to choose, it's important not to get too worried by the thought of worst-case cost scenarios. While it is possible to have an unlucky year where you have lots of medical expenses, and you should have a plan in place to handle that if it does happen, most people never come anywhere close to reaching their annual deductibles, let alone their out-of-pocket maximums. The fact is, while your tolerance for risk is something only you can measure, most people's medical spending simply doesn't reach those levels. In fact, in 2018, 75% of plan members spent fewer than $811 out of pocket for medical expenses and prescription drugs combined, and 50% of plan members spent less than $180. Another thing to keep in mind as you make your decision is that Inframark provides you with a variety of tools and resources to help you manage your healthcare experience, cover unexpected healthcare expenses, help you stay healthy, and reduce your costs along the way. One such tool is the Healthcare Flexible Spending Account, or FSA. FSAs are great for making sure you have money set aside for any healthcare expenses that might come up. You'll sign up for your FSA when you enroll in your benefits. You just choose how much you want to set aside for the year, and then you'll fund your account with pre-tax payroll deductions every time you get paid. But here's an important feature for your FSA. Although you'll be making contributions every pay period, the full amount you commit to setting aside will be available on the first day of the plan year. That means you can start using your FSA money on January 1st, 2020. You are allowed to put as much as $2,700 into your 2020 FSA. Finally, you should know that while the FSA is generally a use it or lose it account, you are able to roll over up to $500 if you're unable to use all your funds by the end of the year. Because any unused funds over $500 will be forfeited at the end of the year, you should only plan to set aside what you think you'll be able to use. Another tool you can use to pay for healthcare expenses is MedPut, which can provide you with an interest-free loan that you repay through automatic payroll deductions. In fact, all employees in an Inframark health plan with at least 1 year of service are automatically eligible to access as much as $2,000 in free financing for qualified medical, prescription, dental, or vision expenses. And for an extra 77 cents per pay period, you can increase your coverage amount from $2,000 to $3,000. The way MedPut works is simple. First, you send MedPut a copy of the bill you want help paying. Next, MedPut will try to lower the amount of the bill by negotiating with the provider. Then they'll pay the bill on your behalf, and you'll start paying back the balance through low automatic payroll deductions. This Inframark provided benefit can be an important and useful resource to help you manage larger or unexpected out-of-pocket healthcare expenses in an affordable way. Another way you can protect yourself from the pinch of a large and unexpected medical bill is to purchase additional insurance coverage From MetLife. Critical illness insurance and accident insurance, which you can buy separately or together, can provide you with a lump sum payment to use however you would like if you were to experience a covered event, like a heart attack, stroke, or cancer in the case of critical illness coverage, or injuries you might sustain from playing sports, doing housework, or running errands in the case of accident insurance. The amount you pay for critical illness and or accident insurance is based on your coverage selection and other variables. The next resource is Teladoc, a virtual healthcare service that allows you to speak to a board-certified physician by video chat or phone call. Teladoc can be a fast and cost-effective way to see a doctor quickly, without having to take time to visit an actual doctor's office. You'll be able to get treatment for minor acute health issues, including getting prescriptions written when necessary, without having to use an urgent care clinic or emergency room. Teladoc also includes mental health services, so you can speak to a licensed counselor, therapist, psychologist, or psychiatrist. Teladoc consultations are completely free, meaning no copayment, for Inframark employees who are enrolled in the Enhanced PPO with HRA plan, the Basic PPO plan, and the Value Care PPO plan. Employees enrolled in the HDHP with HSA plan will pay just $40 per consultation, but that cost is considerably lower than the full expense of making a visit to a doctor's office or urgent care facility. An additional resource can be found in Health Advocate Empowered Health, which can help you get the most of your health care and coverage by assisting you with processing insurance claims and paperwork, managing chronic health conditions such as diabetes, asthma, or depression, negotiating fees for healthcare services, helping you locate the best, lowest cost healthcare services and providers in your area, and so much more. Finally, if you or one of your covered dependents happens to be living with diabetes or hypertension, you should know about Livongo, a health management program that provides you with free monitoring and testing supplies, along with expert telephonic support from certified coaches who can help you manage your condition and avoid costly complications. Between your ability to save with tax-advantaged accounts like the FSA or the HSA, borrow with healthcare financing from MedPut, insure yourself against the unexpected with critical illness and accident insurance, and avoid or reduce out-of-pocket expenses with services like Teladoc, Health Advocate, and Livongo, you should feel comfortable with whatever health insurance plan you choose. Just remember that the plans that limit your out-of-pocket spending up front will cost you more in premiums, and the plans with cheaper premiums will require you to pay more out of your own pocket when it comes time to use healthcare services. Let's take a moment to review your plan options. Remember, the standard PPO plan from 2019 will not be offered among your choices for medical insurance in 2020. Your 2020 medical plan options include the Enhanced PPO with HRA plan, which is a new offering, the Basic PPO plan, which is the same Basic PPO plan that was offered in past years, the Value Care PPO plan, which is another new plan offering, and the HDHP with HSA plan, which is the same HDHP with HSA plan that was offered in the past. If you would like some additional assistance in determining which plan option is the best for you, you can use Alex, the online benefits counselor. Alex will ask some basic questions about your household's healthcare use and help you estimate your total premiums and out-of-pocket expenses, so you can compare how the plans stack up and find the one that makes the most sense for your budget and your needs. It's important to let you know that we have only been able to summarize the key features of the plans and programs we've talked about today. You can find more details in the booklets mailed to your home, on our website, by reaching out to Health Advocate, or by contacting the Inframark Employee Benefits Info line. Remember, you will have to make a decision during the open enrollment period and enroll online between November 4th and November 22nd. And if you need help accessing the online enrollment system, a full set of instructions are available in your guidebooks. That's the end of our presentation. Thanks for watching.